Hi, everyone. Thank you for joining us today for the last of our fall webinar series with the Qualitative Research and Innovation webinar series that presented by NVivo and Sage Publishing. And today we have the topic of Introduction to Rapid Qualitative Research with Dr. Cecilia Vindrola, and I'll introduce her in a second. Before I do that, I'm just going explain some of the options with GoToWebinar, how you can participate. So on the top right hand corner of your screen, there's an orange box with a white arrow. Just click on the white arrow and you'll get to the menus. And so you'll see in one section, there's question area. Chat, you can type in questions at any time. We won't take questions till the end, but feel free to type them in as we go. Also, there's a handout. So if you open up the handout, little caret there, you'll see the PowerPoint slides are available to you, so feel free to download those also. We're also recording this, so you'll get the recording sometime next week in an email too. So, but thank you again for joining us. We're still getting people join. So I'm just going do some introductions here. So my name's Stacy Penna. I'm the NVivo Community Director at QSR International. I'll be talking more about the community at the end, just to tell you about upcoming events and how you can join. My co-host, Ali Owen, she's with Sage Publishing. She couldn't make it today, but she wanted to say hi, and it's been great working with Sage on this webinar series, and we're actually going to have a series in the spring too, starting in January, so I'll talk more about that, like I said, at the end. But I would like to introduce our presenter, Dr. Cecilia Vindrola. She's a senior research fellow in the Department of Targeted Intervention at the University College London. And she's part of the Rapid Research Evaluation and Appraisal Lab. So we're excited to have Cecilia today. So hi, Cecilia.
Hi, Stacy. Hi, everyone.
So I'm going to make, so before I do that, we're just going to do one poll because we thought it might be interesting to see your, so I'm going to launch it and you'll see the poll up there. So if you don't mind answering, have you attended any training in rapid qualitative research, just to give Cecilia an idea of your experience. So I'm just going to let that poll run for a second and then I'll give the percentage numbers. All right, so we have about, it seems around 11 to 10% say yes, and 89 to 90% say no. So I don't know if that, does that surprise you, Cecilia, or?
Not really. I mean, there isn't lots of training available anyway, and I think that's one of our findings. So no, that's really helpful. Thank you.
Okay, so I'm going to make you presenter now, and yep, almost. I can see your PowerPoint, just not the full version.
Yeah, is that okay?
Not yet. Might just be taking some time.
Mm-hmm.
So yeah, I don't know if I want to try to go to slideshow on top and say start. Huh, that's weird. Well, just so you know, we can see it, but we see the slides on the left too. So it's up to you. It's okay if we see those.
Strange, because on my screen I'm seeing it.
It might be. You might have to duplicate your screens with the GoToWebinar or with your. Yes, now we can see it. Perfect.
Yeah, is that all right?
Yep. Excuse me. Yes.
Excellent. Okay, sorry about that. Technical difficulties. It wouldn't be a webinar without them, right? So thanks so much, Stacey, for the introduction, and thanks so much for the invitation to deliver this webinar. So the idea today, so this is Introduction to Rapid Qualitative Research. It's just a really brief overview of the field of rapid qualitative research. There's a limit to what we can do in 45 minutes. So my goal today is to give you at least an overview of what the field looks like, what are some of the most common approaches used in rapid qualitative research, what is some of its rich history. These approaches are not necessarily new, so the idea today is also to pay a bit of tribute to lots of the researchers who dedicated their time to develop these approaches. Highlight some of the, I guess, common features across all of these techniques that are commonly used, also highlighting limitations and challenges of doing rapid qualitative research, understanding the fact that these types of approaches are not suitable for absolutely all topics in all contexts, and then end the session with just a brief description of a study that we carried out very recently during the COVID-19 pandemic using a rapid appraisal, so you can see how we've applied some of the things that I will have discussed towards the beginning of the session. So, so as Stacey mentioned, I'm based at UCL. I'm a medical anthropologist by background, and one of my main areas of interest has always been applied health research. And within that kind of applied health research tradition, the idea that all of the research that we do to be able to generate findings that can ultimately inform changes in practice and changes in policy. And with some really excellent colleagues, we developed and continue to kind of drive the work of the Rapid Research Evaluation and Appraisal Lab, and I co-direct this with another medical anthropologist called Ginger Johnson. And REAL really tries to bring all of this together in terms of methodological experimentation, but also looking for ways in which we might actually use research findings in practice. And instead of me talking about REAL, in my next slide, I've got a little animation that should be able to show it in an easier way.
So, Cecilia, just so you know, it's probably GoToWebinar. We can't hear the animation, but we can see it, just so you know.
Carries out rapid literature reviews, quick appraisals, rapid ethnographies, and evaluations, and advises other teams or organizations. The Rapid Research Evaluation and Appraisal Lab uses research to improve healthcare systems, programs, and interventions delivered in time-sensitive contexts. REAL is a multidisciplinary team with expertise in qualitative and quantitative research. REAL delivers face-to-face and online training, carries out rapid literature reviews, quick appraisals, rapid ethnographies, and evaluations, and advises other teams or organizations on the use of rapid research approaches. Current areas of research include the organization and management of healthcare delivery, the use of rapid qualitative research in clinical trials, global health and complex health emergencies. For more information, please visit our website.
All right, sorry about the technical difficulty there. I hope you were able to get at least most of that. So yeah, so that's what REAL, that's what we do, and those are our areas of focus. But if I take you a bit back in terms of time and why we decided to develop this team, I need to take you back to another epidemic. So a lot of our work started during the Ebola epidemic, and what we were doing at that time is we wanted to explore how social sciences were playing a role, I guess, in informing epidemic response efforts. And many of you probably already know this, but the Ebola epidemic really represented a change in trends in terms of inclusion of social scientists, particularly anthropologists, and really actively trying to include lots of the qualitative data that they were generating into informing epidemic response efforts. And I've included a few of the platforms that were used here as an example. But what many researchers were also saying at that time was that there were lots of missed opportunities for the incorporation of qualitative data for these same purposes, right? And these missed opportunities at the time were identified due to two main reasons. One of the reasons was that when social scientists were allowed, I guess, a seat at the table in terms of decision making, they were not able to generate findings at a time when these could be used to inform decision making. So there used to still be this idea that for qualitative research to be valid, to be meaningful, there was, a long period of data collection and analysis would be required. So that was one of the key things. The other key thing was the fact that when findings were shared, they weren't shared in a format that made them actionable, in the sense that they weren't shared they weren't communicated in a way in which then, let's say, public health authorities could take those findings and could easily implement them to inform some of the work that they were doing at the time. So taking those two things into consideration, we then went on to do this review that we published up here that was looking at the role of rapid qualitative research methods during complex health emergencies, trying to see how other research teams had used them in the past. And that work and then this question that Scrimshire and Hurtado posed over 30 years ago, that has really shaped a lot of the work that we're doing at the moment. And Scrimshire and Hurtado's question was, must one spend a year in the field collecting ethnographic data or potentially other forms of qualitative data in order to make useful recommendations for a health program? And what the field of rapid qualitative research says is that that's not necessarily the case. Meaningful, rich, incredibly useful data can be potentially collected within a smaller duration of time, but also can be shared with stakeholders at different time points to inform different types and different levels of decision making. And we'll talk about how that's done today. So one of the key things to start thinking about when looking at the field of rapid qualitative research is this question that I've highlighted here. And what you'll see is, so I've said, why does some research need to be rapid? And I've kind of put in italics and highlighted the word some, just of course to go back to this idea that not all topics and not all contexts are amenable or suitable for rapid design. However, a lot of the work that we do is. And one of the key things of the field of rapid qualitative research is trying to consider timeliness as an additional variable when thinking about the quality of the study. So McNell's quote, which I love, is the timeliness of information is no less critical than its accuracy. And it's actually trying to make us think about the fact that timeliness will influence how useful research will be. Yeah, and the reason for that is only findings shared at particular time points might actually be able to inform decision-making processes. Now, the other reason, and this is really tied into a lot of the work that we've done with epidemics as well, is that some research topics are time sensitive. And so if situations, perceptions, events are not captured at a particular point in time, then we will lose valuable information. And even if we wanted to capture that in a retrospective way, it will probably not be the same. So I'll come back to this when I talk about the study that we did during COVID towards the end of the session today. So whenever I talk about rapid qualitative research, I always get, I guess, this question from at the beginning, well, what do you mean by rapid? What are these rapid approaches? What are rapid methods? And quite a few people have already tried to map the landscape, and I always recommend this review by McNell and Foster-Fishman. It's a bit old, but I think it gives a really nice overview, especially if you're just starting out in this field. And what they try to do is to map this landscape of what they call rapid research and evaluation methods, or REAM, and try to identify what were the core elements of the approaches being used within this field. And what they did is they come up with the four that I've included in the circle here at the bottom of the screen. So what they said was that these approaches were rapid in the sense that the study was carried out anywhere from about a few weeks to a few months. It could be participatory, or at least include some level of participation, and this could be community members, but it could also be other relevant stakeholders as well, and including them in different stages of design, or also even as researchers during data collection and analysis processes. It tended to be team-based in the sense that you would have a research team carrying out the study, both potentially as field researchers, but also during the data analysis stage of the study. And this idea that as a team, you're able to cover more ground or potentially bring in different perspectives. Now, having said this, and I'll talk about this a bit later today, we've also identified a few approaches in rapid qualitative research that are based on individual researchers, or what we call lone researcher models, right? And the last feature, which I think is one of the most important ones, is the fact that the study designs are iterative. So iterative meaning that multiple stages are probably running in parallel and are informing each other throughout the entire duration of the study. And we'll come back to different kind of layers of iteration in a bit. So in addition to that definition, there's this very interesting definition proposed by Bibi. If you're just starting out, I think this book on rapid qualitative inquiry will probably be very useful. You'll see some of the features identified here resonate with the ones that McNally and Foster-Fishman highlighted, particularly in terms of iterative design and the use of teams. But two things that I think are important to highlight here is the focus that, according to Bibi, these approaches have on the insider's perspective, so the Emmett perspective, the idea of trying to see the world through another person's eyes, really, and also the idea that these types of approaches will tend to combine different sources, data sources, or different methods for data collection, and will look to integrate these in different ways during analysis through stages through processes of triangulation. So a few key features to keep in mind. And the next question I always get is, what do you mean by rapid? So how rapid are these rapid approaches? And unfortunately, I can never answer this question, but what I can tell people is I can tell them, this is what I found in the literature so far. So you'll see lots of variation here in terms of what we mean by rapid. We've carried out a few reviews where we've tried to map out study duration as well. You see here this one, because of the nature of the context, so this is all about complex health emergencies. You're seeing these studies are really, really, really rapid, a few days. But also in other reviews, for instance, this one where we've looked at the implementation of rapid ethnographies within the healthcare sector, you see a slightly longer duration duration of studies, anywhere from 5 days to 6 months, but still quite a bit of variability. So definitely an area of future exploration, and something that potentially as a community we might need to start thinking about in terms of what do we mean by rapid, and being able to define that if helpful in some shape or form, right? Another thing to keep in mind in terms of when we're looking at diversity and variability really is all of the different rapid approaches that are parts of this rapid qualitative research field. And I've just mapped a few here for you. There's a book that I'm developing at the moment with Sage that's called Doing Rapid Qualitative Research, that's coming out next year, where I try to map out more of the history of these approaches, looking at their interrelationships. Many of these have in some shape or form cross-fertilized over the years. Sometimes these labels are used interchangeably, but having said that, each of these have their own features and their own characteristics. So in that book, I try to map that out for you, especially if you're just starting out, to find out, what is this field of rapid qualitative research. But things to keep in mind here is that these different approaches also have different types of aims and some characteristics around design, and it's helpful to have a toolkit to some extent, where you, depending on the nature of the study, so depending on your research questions or your aim or the level of participation that you want to integrate in the study design, the structure of your data collection or data analysis tools, the size of the team, or if you're aiming to do this as an individual researcher, or how you want to share findings, if you want to share them doing regular feedback loops or regular time points throughout the entire duration, or if you're aiming for more of a one-time sharing of findings, that you're able to then tease out what the differences of these approaches are and identify the one that's more suitable for these different variables. So this is, I guess, the idea of creating this decision tool, which is will be a part of the book and is also available on our website to provide a bit of guidance for those who are just starting to design their own rapid qualitative studies. Now, having considered then all of that variability, some of our work has also centered on trying to identify what are actually the key features of rapid qualitative research. So where do all of these different types of approaches and ways of generating knowledge in a more rapid time frame, where do all of these actually, what is the agreement, I guess, across all of them? Where do they all come together? And these are some of the ideas that we've developed over time. So in general, and of course there's always exceptions, but in general, these types of approaches require quite a bit of time at what we would call a preparatory or design or scoping stage before you're able to start with data collection, so that you're able to be well informed at the design stage, have considered potentially all of the problems you might face, or have really done a lot of work to try to focus the aims of the study or your research questions, so that by the time that you get to the data collection phase, you're able to use that time very efficiently, or at least as efficiently as possible, so that you don't require lots of time for data collection. So that's one of the key characteristics. The other one would be this idea, and going back to the concept of an iterative design, of being able to carry out data collection and analysis in parallel. And this allows you to do multiple things, right? If you're analyzing data as you're collecting it, first of all, one of the key things you can do is you can, as the other feature at the bottom of the screen says, you can actually develop these feedback loops and share emerging findings with stakeholders as the study is still ongoing. And you can actually use some of the feedback from stakeholders and then make changes in your study design or make changes in your data collection processes if that's something that's required. The other thing that this kind of iterative design of collection and analysis allows you to do is it also allows you to identify if there's any gaps in data collection while you're still in the field or while you're still carrying out field work, and you can address those gaps almost in real time. So that's another benefit. A couple of other things in relation to these key features would be the fact that in many ways data analysis needs to be considered as a process that could potentially involve different layers as well. So you might be able to do some quick analysis. So especially if you're doing a very rapid kind of type of feedback loop to your stakeholders. So you might be identifying key high-level, key emerging findings and sharing those very quickly. But then you might also think about additional layers of analysis you might want to add to the study, where you're doing a bit more in-depth work, where you're going back to your raw data in a different way, where you're engaging with theory and you're bringing in different types of angles into the study. So within a rapid qualitative research design, you can do all of these different layers as long as, of course, that you've organized it within your study time frame. But one of the key things here is many times rapid research is considered as I guess, a quick and dirty exercise, where you might, there's the assumption that you might not have time to engage in more in-depth analysis or to engage with theory in the same way as you would in a more conventional qualitative approach. So I think thinking of these different layers of analysis is something that's important, I think, especially if you're just starting out. And I've got an example of how we did that in practice towards the end of today, so hopefully that will be useful. And again, this idea of relying on team-based research in some way, which many times has lots of pros. So as I mentioned before, potentially covering more ground in a shorter amount of time, bringing in different perspectives, people from different disciplines, and how that adds richness potentially to the study. But at the same time, lots of challenges with team-based research. And I'll touch on this a bit later today, but trying to ensure, of course, if you've got a big team, you need to ensure that there's consistency being maintained in relation to data collection and analysis. And there's quite a few issues that can emerge around having researchers with different levels of expertise and having to deliver training as part of the project. So pros and cons to team-based research, and also considering the fact that some rapid qualitative research approaches can be carried out by individual researchers as well. So this now takes us to I guess, one of those first features around iteration. And sorry, I've developed this diagram here to show some of the layers of iteration that are normally used. I'm sure there's quite a few other ones, but this just gives you at least an idea of the key ones. So thinking about that preparatory stage that scoping stage that we've outlined here, and how that early work will influence that study design. Once the study design, then how that is, of course, going to shape data collection and analysis, and as those are carried out in parallel, how they will inform each other, and then thinking about how then, because we've analyzed data as we're collecting, we can share those emerging findings, but seeing that sharing of emerging findings not just as a dissemination, kind of very linear dissemination phase, but seeing it more as a feedback session where stakeholders might actually give us important information, or they might ask us questions or identify gaps in our findings, and we can then take that information back and actually shape that study design, and kind of the cycle keeps going and going from that. So what do we mean by that preparatory stage, or that scoping stage? Like I said before, normally that stage takes a bit longer. It might be, you might need to invest a lot more time and energy into that preparatory stage compared to other stages of research. It's a stage where you will potentially work as a team to identify the need for the study, to start deciding and then potentially refining what the research questions will be, identifying suitable theoretical perspectives to guide the study. That might be linked to also reviewing existing literature or collecting information on the area. A lot of the work that we do during this stage is also about engaging with stakeholders, trying to understand, having conversations with them, even if they're informal conversations around what they want us to accomplish with the study, what the doing potentially informal touring of areas, observations that give us a flavor for the context. So all of that kind of early exploratory work, again, trying to understand what the study is going to be focusing on. And all of that information is then going to influence decisions around identifying what the best rapid research approach will be, and then, you know, mentioning again the decision tool that I've showed earlier, will inform, of course, selection of methods for data collection and analysis, and will also inform the design of the dissemination plan or a dissemination strategy. And here it's thinking about dissemination at a really early design stage, because you know, if you've engaged with stakeholders and if they've told you, for instance, that they need feedback in some shape or form, you know, once a month, let's say, from the beginning of data collection, that needs to be built into your study design so that you're able to generate, you know, useful and also at the same time valid findings with that level of regular feedback, right? And here I've just outlined it's just an example of a scoping study that we carried out recently, and this was 6 weeks long, but it's just to give you a general idea. I mean, we've done scoping projects that have been 2 weeks long, some that have been 8 weeks long. It really depends on the overall duration of your study. And normally what we try to do, and of course, you know, this is just a suggestion, but we try to combine informal conversations with stakeholders. Normally not many of these, but at least capturing the views of different groups. We try to combine those with observations. This could be, you know, really depends on the study, but these could be observations of different areas, more informal touring, or actually could be observations during structured meetings, for instance, where specific topics or programs are being discussed. And then combine that with a documentary review, capturing potentially some of the reports or documents that are being developed on the topic, just to get an idea potentially of the context, but also maybe using the documents to reconstruct history in a different way, right, to map out that context, I guess, for the study topic. And then we would take all of that information and we would try to develop at least our general understanding of the area that we will be studying. We will try to at least propose some potential research questions, a potential study design, and a dissemination plan. And the idea is we then bring together all relevant stakeholders into a form of a scoping workshop. But, you know, it could be something as just a very simple meeting. And the idea is to start teasing out some of these proposals for the study, and to come together and co-design in a way, or co-produce these. And so really interesting discussions during scoping workshops, and the actual outcome of that scoping phase is to get that agreement in terms of the research questions, agreement in terms of the scope, because many times when we carry out a rapid study, one of the most important things we need to do is to make sure that it's targeted enough, it's focused enough for us to be able to generate meaningful findings in a short amount of time. So sometimes those conversations, early conversations with stakeholders, are useful to manage those expectations and to make sure that the study, a rapid study, would be feasible in this situation, right? So, agreements in terms of that, what the study design will be, and most importantly, agreements around the dissemination plan and what the key deadlines will be for the sharing of findings, and then as a team building that into our own study proposal. So we've done that. So we've done the scoping study, we've agreed the study design, and now we're ready to begin with our data collection, data analysis phases. And like I mentioned before, these are carried out in parallel quite often in rapid qualitative research and inform each other, right? And here I've outlined, this is just one approach that we take quite frequently, and I thought it would be helpful to give you a visual of, how do you actually do that? How do you carry out data collection and analysis in parallel in this way? And how do you use those two stages then to share those emerging findings? So this diagram here gives you an idea of an approach that we use a lot, which is based on the use of a rap sheet. And a rap sheet is not something new. So rap sheet stands for Rapid Assessment Procedures. Rap sheets have been used for a really long time. Previously, they were used mainly as a way of summarizing the study protocol, or maybe providing a general summary of all the findings. The way in which we use it is more as a working document during data collection. And so let's say we've got the study that I've outlined here in the slide. So we've got a study where, and here it's kind of in the spirit of collecting qualitative data during a pandemic where we actually cannot go on site and everything is done remotely. So we've got a combination of telephone interviews and we're carrying out, let's say, observations remotely, so via kind of a virtual platform, right? And so I've got a team of researchers who are all collecting data at the same time. And what would normally happen is, so let's say researcher one would carry out an interview. The interview would be audio recorded, but during the interview, the researcher would take notes documenting that conversation. And then those notes would be added onto this rap sheet. So a summary of the notes of the interview are added to the rap sheet. Now, what the rap sheet contains is, the rap sheet is just a fancy word really for a table. And that table has, in one of its columns, all the different rows in that table will actually be categories that the team has already predefined. Now, these categories will, of course, be influenced by the research questions. Sometimes, if you're using an interview topic guide to guide the interviews, each of those questions will then be translated into a category that will be included in the rap sheet. You might be using a particular conceptual framework to frame the study, so you might want to bring in some categories from that. Anyway, in a way, it allows you to summarize data as you're collecting it. So researcher adds key findings from interview one into that rap sheet, and then they do an observation later that day. They've got some notes from the observation. They add the observation notes into that same rap sheet, and then they do a second interview and a similar process where they add it to the same rap sheet. So that rap sheet becomes a repository for the key findings, not only of one of the methods of data collection, but actually all of the methods of data collection. So it's generating a synthesis of those in real time, but it's also acting as a triangulation tool from really early stages. Now, in addition to that, because we're working as a team, we've got team meetings where we're starting to discuss those emerging findings. If you are using one rap sheet per researcher, then during those team meetings, researchers would come to the meeting, each with their own rap sheet, and we could start teasing out what are some of the findings that each of us have started to document. Are we seeing any similarities? Are we seeing any differences? Can we then take all of these rap sheets and generate a one-page, I'm just saying one page, but it could be, any type of short summary of emerging findings that we can share with our relevant stakeholders? And that's kind of the first green box that you see here. Now, the rap sheet, this is always as the study's ongoing. You could also start using the rap sheet and some of these discussions to start teasing out areas where you think you might need more deeper analysis. And then I'll show you kind of what that process looks like in a bit. But that deeper analysis might take you then into some additional work with your raw data. And also you might actually turn some of that into, if you're aiming for an academic audience, to start writing up manuscripts for publication. Now, in the example I mentioned before, I talked about using a rap sheet per researcher, which is something that's used quite a bit. But in many of the studies where we have carried out data collection across multiple sites and then carried out some sort of cross-site comparison, we prefer to use one rap sheet per study site. So let's say we've got a couple of researchers working across each of the sites, then both of them would work together with the same rap sheet. And in that case, the rap sheet allows us to synthesize the information from multiple researchers, multiple methods for data collection, representing really what's coming out of that site. And after we finish data collection, what that allows us to do is, if you wanted very simply to put one table next to the other, if you wanted something a bit more visual, then you can look across all of those tables and you can make a quite clear comparison across the different sites, potentially start identifying some trends. Similarly to this, we've used one when we're interested in comparing, for instance, across different groups within our sample. So if we're carrying out a study looking at different groups of healthcare professionals, we might have one rap sheet for doctors, one for nurses, one for allied health professionals, and compare across that way. We've also used rap sheets to compare across different points in time. So you might have one rap sheet per different stages of the study as well. And again, just as a reminder that the idea is also that for the rap sheets, in addition to create that summary of findings and being able to share that in real time, also being able to use them as a triangulation tool. This is just a really simple table that we've used before as a rap sheet. Of course, rap sheets also change over time during the study. Of course, as you're collecting data, you will also refine the rap sheet and adding potentially different levels of detail to it. The important thing here, especially if you're collecting data as a team, is that if one team member starts making changes to the rap sheet, to make sure that all of the other team members make the same changes. Because another, I guess, benefit of the rap sheet is allowing the team to maintain consistency in both data collection and analysis. So you've carried out the data collection, you've done the analysis in parallel, you've started sharing some emerging findings, and then you're going towards kind of that end of the study where you're actually now, you want to dedicate a little bit more time to engaging with your data. And potentially doing a fuller piece of work, analyzing some topics in parallel, and potentially your rap sheet allowed you to identify what those topics would be. So we did a piece of work trying to look at different techniques that research teams have implemented, and that's published in this review that you see here. We've looked at both data collection and analysis, but one of the findings the key findings of the review was that many research teams are trying to bypass some stages during that early analysis phase to save time. And one of the key ones has been to bypass interview transcription or to tweak the way in which we transcribe. So in some cases, in bypassing transcription, researchers have used different techniques to code directly from audio recordings, and you'll see a few authors here, with the Rita method being one of the, I think, most used ones. Researchers also using software like voice recognition software, where text transcripts can be generated from audio recording in a few minutes. And our team has really engaged. We've been using the NVivo voice recognition software for quite some time now, and that's been really helpful, at least in creating that first kind of cut of the text data and giving us that engagement with interview transcripts without having to either do it ourselves and investing all that time, or having to spend a lot of our research budget sending recordings out for transcription. So that's just to give you an idea, if you want to look at some of the techniques in a bit more detail. That's some of the key literature that we found so far. But when we're actually looking at rapid data analysis approaches, what we have found is that really most of the rapid qualitative research approaches that I've mentioned today tend to rely on some form of table-based methods. So this is the use of, well, I've talked about the rap sheet already, different types of tables or templates or performers to help research teams reduce the volume of data and identify what the key findings ultimately are. And what we've done, and I'll show you an example of how we've done that in a bit, is we've combined the use of the rap sheets, like I've described them, with framework analysis, which is the last approach that you see here. And what framework analysis allows us to do is it allows us not only to identify the key, I guess, the key categories that we might want to, for instance, code in our transcripts, our observation data, our documentary data, but also chart the data in different ways, visualize it in different ways to identify potential patterns or trends that we had not realized initially. So I've outlined some of the stages of framework analysis here. And framework is not only used in rapid qualitative research, it's used in long-term research as well, but ways in which we've adapted some of these different stages slightly for rapid design has been, like I mentioned before, we might be bypassing full transcription, we might be doing selected transcription or trying to speed it up through voice recognition software. The familiarization and coding stage, we might actually begin those stages as we are collecting data. So like I mentioned before, having the rap sheet to start making sense of the key findings is a very, very effective tool for familiarization, but we might also start having some team discussions around what are some of the potential codes that we think we could later use potentially after data collection is complete, and start even designing a potential coding framework that we can then apply quite easily after we've completed data collection. And then we get into the stage of charting and exploring those connections, and framework normally allows you to do something that's similar to what's in this table. So you would normally have your topics, and these could be codes, or codes could be grouped even further across these different columns, as you see here. And then you would have your cases, and cases could be individual interviews, it could be interviews, observations, documents, it could be many different things. But and then in the cell, what you have is the actual raw data. And what charting in this way allows you to do is quite rapidly, if you're interested in understanding what everyone in your study, in your sample, let's say, has said in relation to topic 1, you can look down this column and actually tease out what the main findings are. And then if you wanted to do some further comparisons, for instance, if you wanted to distinguish between the cases that are, going back to the example of professional groups, so you want to distinguish between doctors and nurses, you might then filter by different rows, and you might compare some of the findings across these different groups. So quite, I guess, a useful technique, and especially if you are pressed for time, there's all these different tweaks that you can make during some of the early stages of framework to make sure that you're using the time that you're collecting data to already become familiar with your data, and even design a potential coding framework that you can then apply. So we've kind of covered this iterative data collection and analysis, and we've touched slightly on sharing of emerging findings, but I wanted to come back to this stage of sharing findings and dissemination, and really looking at it as something that it's a stage that accompanies a rapid qualitative study from the very beginning, right? So it's not kind of something that we just do at the end. And some of the strategies that have helped us to then integrate the sharing of findings in our research has been teasing out what our dissemination goals will be from really early on, what the dissemination mechanisms are, and not defining these ourselves as a team, but actually defining these in collaboration with the stakeholders who will ultimately use the findings. So having a conversation around what are their preferred formats, when would they like to receive them, what's the frequency, who needs to be involved, and using all of that information to develop a dissemination plan, potentially like this one, where we're teasing out specific within our study timeline when our finding is going to be shared, what type of dissemination is it, what's the purpose, what's the format, and who needs to be involved. The last thing I want to touch on in terms of features is going back to this idea of team-based research, just highlighting the fact that different rapid qualitative approaches have looked at teams in different ways, proposed different compositions and sizes of teams, so just mapped a few here for you, but also considering some of the challenges that I mentioned before around the fact that you might have team members with different levels of expertise, you might need to support some team members more than others, or even integrate into the study project a process of training team members, and that's quite common in some approaches like RARE, for instance. RQI, Rapid Qualitative Inquiry, has also developed a training component within, I guess, the actual project duration. And also the fact that many of these rapid qualitative approaches will rely on the use of structured tools in the form of field guides or structured manuals, or even the rap sheet that I mentioned before, to make sure that that all researchers are collecting and analyzing data in the same way. I've put an example here of this piece by McMullen, where they actually present a copy of the fieldwork guide that they use, and that might be helpful to some of you. Another takeaway message, I guess, is also to think of different ways in which rapid qualitative research is actually being used. And many times we think it's normally just done as a standalone study, as kind of here at the bottom right-hand side. But actually, those different types of designs and combinations, you could carry out a rapid study and then inform a longer piece of work. You could carry out a longer study and then use a rapid study to maybe get a bit more depth in terms of some of the findings, or clarify some of the findings if that was required. You could also be running these in parallel and include different types of feedback loops in your rapid study to inform some of the work that you're doing in the longer study as well. And then just wanted to briefly touch on some of the challenges of rapid research that I've already touched on some of these today. But just things to keep in mind around potential trade-offs between breadth versus depth of data. This idea that if you do want to do a rapid piece of work and you want to produce in-depth data, then that might mean that you will need to really focus the scope of the study to be able to achieve the richness that you're looking for. The fact that there are some potential limitations around sampling. So for instance, there's an argument that's been made that many times if you're pressed for time, you might be relying on research participants who are most accessible to you and potentially not have enough time to engage with harder to reach populations. So that's something that the team definitely needs to consider. I've talked already quite a bit about team members, managing data collection as a team, but also training team members with different levels of expertise. And I think one of the key things to consider here as well has been, like I mentioned before, this reputation that rapid research has, that it tends to lose, I guess, its critical angle, or it tends to be atheoretical, or research cannot engage in reflexivity because of time pressures. However, in our experience and also reviewing some of the literature, we've seen really, really interesting pieces of work that have taken on a rapid design and have still maintained that theoretical and critical, I guess, lens. And here I think it's important for teams to build this into the process of generating knowledge and build it into the research process themselves. So it's not necessarily, at least in our experience, a theoretical work is not necessarily a product of time pressures, but it's more about how the team are thinking about research in itself. So that's something, of course, to keep in mind. And of course, practical limitations affecting rapid research, a big one, and I could talk about this for hours, are the delays produced in the review and approval of rapid studies by ethical review committees, and the fact that many areas around the world, these committees have not established processes for rapid review. So that's definitely something to keep in mind. So I think I only have a few minutes, but I just wanted to give you just a visual of how lots of these different features and principles can actually be applied in a real study. And this is a rapid appraisal that we carried out during COVID-19. It's still ongoing, where what we wanted to do is we wanted to capture the perceptions and experiences of healthcare workers delivering care during COVID-19. And the study started in the UK, but then through different collaborations with teams around the world and this concept of mirror studies, so studies being replicated. The study's actually been replicated now in 22 countries, so it's been great because we've really tried to then paint this kind of global picture of healthcare workers' experiences. But in the UK, what we did is we combined these three methods that you see here. So we combined a rapid media analysis, rapid policy review, and then telephone interviews with healthcare workers, particularly frontline staff. So this kind of first point of contact with patients. And for data collection, so we used, you'll see, remember this from before, so we used the RAP sheet to try to identify some of the emerging themes, some of the emerging findings from collecting those from the interviews, discussing them as a team, and then sharing them with stakeholders on a really, really frequent basis. So this study was designed to help inform response efforts in the UK. And it was carried out in collaboration with the Intensive Care Society and with a partnership of different hospitals in London. And there was a time when we were sharing findings twice a week, so just to give you an idea. So it really took lots of coordination within the team to be able to carry out the data collection really rapidly, but also make sense of those findings really rapidly as well. And what we did is, in addition to sharing the findings in this way, is we then started doing some really early work with our RAP sheet to try to identify the key topics. So mainly these were key areas of concern that healthcare workers were highlighting in relation to delivering care during this pandemic. We then had our team subdivided into what we call different areas of focus, and I'll show you a visual of how that was done. And we're able to do a bit more in-depth work into each of these areas, bringing in some of the literature, different theoretical perspectives, and re-engaging with our raw data. We had to use selective transcription because we did not have a budget to transcribe. We then incorporated the voice recognition software that I mentioned before. So engaging in our raw data, agreeing a coding framework, applying it, using the framework method that I mentioned before to chart the data and look at different connections. And then we thought about our dissemination and covering different kind of layers or different audiences as well. So like I mentioned before, early engagement with these stakeholders led to us sharing findings twice a week. And this was done in kind of one-page memos or bullet pointed lists, so something very, very basic. Then we started doing some additional work, drafting some manuscripts for publication, creating accessible summaries so people could engage with so a broader audience, I guess, could engage with the information included in those manuscripts. Then developing slides for presentations. Lots of the hospitals that were part of the study actually preferred a slide deck versus something a bit longer or lots of text, something that was more visual. And then linked to that, also developing infographics to share those findings and engage different, I guess, groups. This is just to give you a visual of how we organized the team. So looking at data collection teams and how we organize those work streams. But then, and these are, of course, these are the same people probably occupied in multiple roles here. So it's, or else this would be an enormous team. But looking at different areas of focus for data analysis. And like I mentioned before, how we took the rep sheet and then did some further work and did more in-depth analysis on each of these topics. And this is a very busy slide, but the idea is to show you here that then these different teams work to develop analysis, what we call analysis with multiple aims, or again, going back to this idea of different layers, right? So the more immediate response efforts and how that was shared. Then analysis that's done to inform other streams of work, and you see here some arrows of different streams that informed each other. But then also within, when we did the more in-depth analysis, to be able to carry out that analysis and the write-up of those findings also for different purposes and in different time scales. So I think a key example is the work that we did in this work stream looking at well-being and mental health, where really early on, after we had completed, I think it was about 33 interviews, we said, okay, let's do a piece now capturing some of the well-being support needs of staff so we can get that out there and it can start informing what's happening at a system level. So we carried out one paper. We published it as a preprint and then submitted it to a journal, and that was out a few months after we started data collection. And now, for instance, we've got bigger data, so we've got about 123 interviews with healthcare workers. We're using those to develop a longer piece looking at mental health effects and how and mental health kind of preservation strategies that healthcare workers have used. So just to give you an idea of different layers of analysis and what they can do. And then we're looking at dissemination, you know, definitely that real-time dissemination that I've already mentioned, looking at more traditional forms of disseminating, like the paper for a journal that you see here at the lower part of the screen, but then also making that paper accessible. So the diagram that you see in orange is actually what we call a visual abstract. So it's a visual representation of what's in the paper, but it just summarizes the 4 key messages from that paper. So if you don't want to read the paper, you look at the abstract and you know exactly what it's about. However, if you then want to find out more information, you've got a link to that paper in that same abstract. You can read the full paper. Now, if we leave kind of the academic audience to one side, one of the key, I think, dissemination products that, you know, outcomes, I guess, of the study were infographics like the ones that you see here. So the one in the middle that actually has a summary of all of the emerging findings. This was shared with all of the hospitals and all of the people who took part in the study. And in a way, we used it as what we call a member checking exercise, where study participants are actually able to provide feedback on our interpretation of findings as well. And there was lots of positive engagement with this infographic. We received emails from staff saying, you know, can I print it? Can I put in the staff room? Can I share it with colleagues? So really interesting. It gives you an overview of everything that we had identified up until that time. Now, the other one that you see here, which is on PPE, so personal protective equipment, is actually comes out of this more kind of in-depth analysis that was done by one of the teams. So PPE was identified as a concern. We then went into the data, did a lot more work, brought in frameworks that had been used to look at PPE and other epidemics, and we then did a fuller piece of work, like this infographic that you see here, really teasing out the concerns expressed by frontline staff. This is my last slide for today. I wanted to end with this because I wanted to show you all of the different types of contributions that rapid qualitative research can make and different ways of thinking about the research that we produce, but ultimately how the findings of our research can be used to inform changes in policy and practice.
Thank you, Cecilia. Before we go to questions, I'm just going to go through a few items on my PowerPoint here, but that was excellent. Very good. We have tons of questions. People are really interested in it. And before I get to the PowerPoint, I just wanted to do one more poll, because this to wrap it up after people learning so much about it. If people just can answer, are the elements of rapid qualitative research, there are elements of rapid qualitative research that might be useful in your work or research. So if you don't mind doing that, that'd be great. So we're getting pretty much 100% yes. So good job. Wow. I think people got a lot out of it. Excellent. So just because of time, I'm going to close that, but thank you for doing that. And I'm just going to go through a few of these items quickly. So I know Cecilia talked about her upcoming book. It'll be available in September of next year. And I think she's sending in one of the drafts, right? Final drafts of the manuscript today. So that's very exciting.
Yes, today.
Yeah, yeah, that's excellent. Good job. And all this is in your handout too. So I'm not going to spend a lot of time here, but with NVivo, Cecilia did talk about the transcription tool, the NVivo transcription that she used, and it seemed like it saved them time and funding, so they could spend more funding on their research instead of on transcription. She also talked about the framework analysis. So NVivo does have that in NVivo. So we have some webinars on how to do that in NVivo, but that was interesting to me. We have collaboration tools and then ways to learn about NVivo. So the community, like I'm the community director, so we had a great fall series with Sage, and now we have our upcoming spring series starting in January. These are all on our website. You can click here and go and start, registering for them. What's great, we always send a recording after, so if you can't make it because of time, that's not a problem. So please go there to register. And also, I actually do a podcast and I interview researchers like Cecilia, which her podcast on rapid qualitative research is coming out this month. So look for that. It's interesting. She talks more in depth about that study she mentioned in her presentation. And to join the community, you can go to this link and join and get updates on upcoming and community events. But also at the end, there's a quick webinar, not webinar, sorry, survey you can fill out asking, do you want to be part of the community? And we'll send you information on how to access that. So I will now go into questions because we had some great questions. So one of the questions many people asked is, can you share a real example of a rap sheet? So I think you had one in your slides, but
yeah, I did.
do you want me to? I can make you presenter again if you want to do that.
Yeah,
Hold
I think it sounds
I'll make you
fancy, but it's basically a table. I don't think it's more than that. Let me.
Okay, just made you presenter again so you can show. Oh,
Yeah.
actually, I could have shown it. Oh well. I just realized that. Do you want me to do that, Cecilia, so you don't have to do it again? I can go into it if you want.
It's
I'll do that.
yeah, if you don't
Hold on.
mind.
No, I don't mind. I'll make myself presenter again. Okay. So I think it was here. I'm just going to get out of.
I mean, I think people will be disappointed when we get to it because it's basically a table. And basically what you want to do is you want to have one of the columns.
It's right here, right? Can you see it?
Yes, exactly.
Okay.
So and this was relevant for this particular study, but of course the information that you include will change. And yes, it's exactly, it's having those different categories in that column, and then the other one being where you actually include your summary of findings. And you can subdivide this in different ways if you wanted to. We've also, in some cases, even added additional categories for key illustrative quotes if you're identifying those as well. It really depends on how you want to use it.
So here's thank you. Here's another question. Can you talk about the data management pieces, particularly as different researchers have their own rap sheets and there are team living rap sheets in addition to the feedback loops that are iterative? I'd love to hear how you streamline the data management and constant learning.
Yeah, so so for instance, if you are using, we normally use rap sheets as part of a team. If you have one team member, each team member has their own rap sheets, which is one of the options that, yeah, exactly. Then normally each team member would be responsible for managing that. And then what you would do is during team meetings, you would share findings. And then also as a team, what you do is you start to agree on potential changes that you want to make to the rap sheet. And the key thing there is for everyone to make the same changes. What we normally have to facilitate that process of making sure that everyone's collecting data in a similar way is we assign a person from the team to be kind of the official cross-checker. Many times it's me, unfortunately, in our team, which is a bit of a tedious job. But the idea there, what you want to do is you want to kind of be able to look across the different sheets of all the team members to make sure that data are being collected similarly. Now we've got a system where we can share, so we've got shared folders, so we've got shared drives, so I can actually access data from all the people on the team, and they can look at each other's as well. And when they add data, everyone can see it in real time. So that really helps us through, you know, we're not reliant on more paper-based systems. And also, if you're using one rap sheet per study site, the useful thing about that is that you might have, let's say you've got two researchers and they are collecting data on the same site. Because we can share those files, then they can both be working on the same Word document, that same table at the same time and adding information to it.
I'm
I
going
hope
to
that
just do
answers
one more.
the question.
Oh, sorry.
Yeah. No,
I'm just going to do one more question because of time.
Yep.
Would you say that the phase after research findings are communicated, example, the implementation phase, should be included in the study's duration, bearing in mind that the implementation often takes a lot of time?
So if by implementation, then you mean kind of the dissemination, so the sharing of findings. So yeah, I think you're looking for my diagram, aren't you? So I would say, I mean, we would normally include sharing of findings within our study timeline. Definitely. It does take a long time, but I think I would consider that at least the emerging sharing of findings within the study timeline. Of course, there's a point where you've kind of shared all you can share and the study's complete, and then I completely agree with the fact that that's kind of where the study would end. Some of the things that we're trying to do as a team now is actually consider a bit more what type of work we can do after we've shared the final set of findings to see if the findings are being used in practice or not. So we're trying to do a bit of work kind of blurring those lines and saying the big question here is, you know, where does the research team responsibility over the findings end, right? Does it end after you've communicated them to stakeholders, or should we be doing some more work with stakeholders after we've shared those final sets of findings to contribute to the ways in which they might actually be used to inform the changes in decision making, changes in practice or policy? So I guess I'm turning that question into a question for everyone in a sense, you know, in terms of should we be thinking differently about study ends and study duration, and should we be thinking differently about the team's responsibility over the findings, or is that responsibility finished once you've submitted that final report, let's say, or should we be doing some more work and extending that beyond?
Great. Well, Cecilia, we have more questions, but just because of time, so this was very interesting. People obviously got a lot out of it. So thank you so much for presenting this. And don't forget let's go to the slide with your book. Don't forget that Cecilia's book will come out in September, and we'll have even more great information in it.
Stacey, would you mind putting the previous slide before the book? Yeah, that's just if you're interested in learning more about the team, that's our website, and an email to join mailing list, and also a list of courses that we normally run online.
Oh, great. Yes, that's right. They do trainings with rapid qualitative research, which is excellent. So, and this is all in the handout, and we'll have, you know, the handout available on our website with the recording too, so you can share it with other people. So thank you again, Cecilia, and I hope everyone has a great Friday and a great weekend.
Thanks, Stacey. Thanks, everyone.